Patient education by far is one of the most important things, or the important roles that a nurse has when dealing with a refugee patient. Refugee patients come from various cultures, thus, some nursing implications will include breaking down the language barriers, so providing a interpreter when needed. Ensure that there is interpreter in the patient's native language in order to ease anxiety and establish rapport with the patient. It is important that a patient understands their plan of care thoroughly in order to provide a better level of healing. So if I know at my hospital we have the interpreter phones, and we can connect them with an interpreter. We have different nationalities that come through our doors, so that's something that's very important, because if they don't understand what's going on, they often won't follow through with their plan of care. The other thing is understanding cultural and traditional practices and religious observances. And as a nurse, it's important to be empathetic and sensitive to cultures, to provide an environment that is safe and respectful to the patient. This includes sensitivity to the opposite gender, respecting religious preferences and observances, and building plan of care modifiable to a patient's beliefs. So if a patient is celebrating Ramadan, then it's important that we do the things that we have to as far as their diet in order to help them and respect their belief. If a patient is Hindu and they don't want anything that's, they want to have a vegetarian diet, it's easier for us to accommodate that, just so that we can let them know that we actually do care. Also, in terms of opposite sex, there's some cultures that you can't look in the eye, and there's others that would prefer a same-sex provider, just because if the opposite sex comes in, it's considered disrespectful. So just really assessing your patient, educating the patient on the U.S. health assessment guidelines, and being their support while they're being assessed. The other thing is coordination of care and case management. This is providing resources such as including multidisciplinary team, so social work, in order to provide healthcare insurance, food, and shelter are essential components of coordination of care. So it's going the extra mile and making sure that they're well-rounded while you have them under your care, and educating them on the compliance and of how to get better and how to modify their situation, and not chastising them at all for not having the means or understanding the process while here in the United States.